Oh,
Hello! We
finally.
made it!
Yeah, thank you so much for having me this afternoon.
Thank you so much for joining. Everyone's been so excited that people are trying to request the screen before you and get
Oh,
their questions in. And I'm like, everyone, please avoid do not contact. But
yeah.
anyway, I want to start off by saying thank you so much for sharing your story with us, which was fantastic about your how you became a doctor, your medical background. I can't believe that you come from a family of doctors. That's your mum, your dad, your
Yeah.
sister.
Yeah. My mom, my dad, my sister, a few of my cousins. Yes, we're all doctors. Yeah, no, it's very interesting. I think we've always really enjoyed the profession, and my parents have done it with so much enthusiasm that all of my generation all became doctors too. So yeah, everyone's really happy, all smiles around.
Well, amazing because you all have this support group within the family, right? So you can all
Yeah.
assist each other. So no one's getting sick in your household, that's
Yeah.
for sure.
Yeah, touch wood. I mean, yes, everybody's been absolutely fine so far, so we're very lucky.
Okay, Dr. Priya, if you don't mind just giving us a little introduction about yourself and who you are. So for those that have just joined in, they know who you are.
Sure. So my name is Dr. Priya Das. I'm a hospital medical doctor based in London. I live in Chelsea and Kensington. And as you mentioned, the rest of my family are doctors too. Um, I mean, I did anaesthetics training for a year and I'm currently doing hospital training in London. So I'm very much enjoying my career and the opportunity that today's given for me to talk to you about, the current era and some of the COVID challenges that the NHS and the UK have been experiencing so far.
Absolutely. I know that everyone is very eager to get to those questions, but just to slow it down a little bit more because I just want to really get to know you if you give me
Yeah,
the
sure.
opportunity. So with regards to for the as you know, I've had many daily interviews with lots of women all over the world in so many various industries. This is the first time I've spoken and had a live interview in Self-Made Girl Boss with a doctor.
Wow.
So it's wonderful for us to have this experience. But for the girls that are watching who do want to become doctors and need to understand, you know, how how much work does it actually take to become a doctor?
Um, so I did my training up north, and it was a 5-year degree. At school beforehand, I had taken all my sciences, so chemistry, physics, biology, and also maths and a few languages up until A levels. I did a 5-year degree without doing any additional research work. After I graduated from medical school in 2010, I then started my trajectory as a junior doctor for 2 years. And after that, I did another year of research. And then I was given the opportunity to subspecialize and to do hospital medicine. I think to answer your question, yes, I think it goes without saying that there are a fair few exams along the way. But I think the way doctors see it is that in order to get a very rewarding and very stimulating career, you have to do a few exams to get to where you want to go. I think at the end of the day, everybody remembers the good times and the exams, but in order to reach the end, to get to the light at the end of the tunnel, a few exams here and there, they start to pale into insignificance pretty much. So it's definitely a very good career. It's a very rewarding career. And whilst there are a lot of exams to do, um, they're a challenge which people take on board and which some people enjoy even. Although I'm not sure I know many people that enjoy exams, but I think it makes the journey as kind of as exciting and as dramatic as it is sometimes. Yeah.
I think it's really interesting what you're saying, because obviously, you know, the world of becoming a doctor really does require a lot of studying and, like you say, a lot of preparation and exams.
Yeah.
But you know, the formula to any success that you wish to have in whatever industry does require a lot of preparation, right?
Yeah.
It requires you to really commit and to almost fall in love with what it is that you do, and for you to be able to enjoy it, and for you to be able to bring out the best results, right, of what you're learning. So really interesting in what you're saying. I do have a question for you. What's it like being a hospital doctor in the UK?
So I've always found being a doctor in the NHS to be very rewarding and very stimulating. I think, as you know, because the UK works with works under the umbrella term of the National Health Service, we have running themes such as, you know, we're very holistic. So in the UK, we very much try and provide a service for patients, for relatives, for everybody. And we're also quite altruistic, so we try and help everybody for the greater good of the population. I think it's a very exciting time to be a doctor right now. For me, I've always thoroughly enjoyed going up the career ladder and doing different things within medicine. I would definitely recommend it. I think right now it's even more interesting in that, you know, what's currently happening is being affected by other countries, the way that other governments are approaching the pandemic, the way that everybody in the community is approaching social distancing and different public health strategies. So it's certainly really interesting as a hospital doctor to be a part of such a complicated, such a stimulating process. I think with all kind of events and incidents that there is a little drama and there is a little hype associated with it. But I think doctors in the UK are handling this challenge really well. And hopefully things will go back to normal really soon.
Hopefully, please. I really do hope that things do start, you know, becoming a little bit easier for everyone. But that brings me on to my next question. How would you describe the world today given the recent events?
Yeah, I think in the year 2020, I think everyone would have said that there are very few things that could stop us to go things that could stop us in our tracks. But here we are conforming to such restrictions, and that is very much the case. Um, you know, I think there have only been a handful of pandemics in the last few centuries. So, for example, there was the Spanish flu of 1918, and in the year 2000s, believe it or not, there was actually quite a quiet pandemic happening in Africa relating to HIV. So there have been game changers. There have been situations in the past century where everybody has stopped in their tracks. So it is very surprising that in today's kind of age, just, you know, in spite of all the protective and preventative measures that world governments are doing and which public health agencies are suggesting that something like this has happened. I think very specifically today, so today's April 25th. I think the really interesting thing right now is about, you know, so the UK government and the UK has basically had time to react to the first wave of coronavirus. So to see what's kind of happened and to assess the damage, so to speak. But right now we're trying to be proactive as well as reactive. So
Right.
I think the government strategy is to try and look forward to the next few months,
Mm-hmm.
and to try and assess when is it going to be appropriate to lift the restrictions, because there's always, the topic of concern is the risk of there being a second peak, so a second wave of
Right.
coronavirus that everybody is currently trying to prevent. We can't really stop what's happened, but right now I think it's very wise to be quite cautious. But at the same time, you know, economies have kind of come to a standstill, jobs are being furloughed, there is a recession, and we're definitely having to recognize that these restrictions and the UK's public health strategies are definitely having an impact, which is not really sustainable in the long run. So it's definitely a super complicated situation, and it's a very interesting discussion to be a part of it.
Dr. Priya, I mean, for everyone that's watching, and I know because even right from the beginning, before the lockdown, it was difficult because not a lot of people really understood what the coronavirus was, right? I mean, you would have seen on the news people buying toilet rolls and stacking
Yeah.
up things that really didn't really have anything to do with the coronavirus symptoms. So for those that are perhaps still, which I hope is not the case, but still does not understand what the coronavirus is, in your
Sure.
own words, how would you explain it?
So coronavirus is actually a name given to a very large group of viruses. So it's the family name for a bunch of viruses which have similar characteristics. So we know from day-to-day kind of life that people can get bacterial infections from bacteria, viral infections from viruses, and less commonly fungal infections from fungi. So when it comes to the coronavirus family, it's actually kind of important to say at this point that, you know, the common cold, so the sneezes and coughs that a lot of people experience every year, that's actually from the coronavirus family. So it's already kind of a group of viruses that's definitely had an impact in our generation on a really regular basis. There are like rarer conditions, so people may have read about conditions such as MERS or SARS, maybe in newspapers and the media. That kind of stands for Middle Eastern respiratory syndromes and specific acute respiratory syndromes. All of these things, they're all from this one family of viruses, and COVID-19, the buzzword that's being flashed around.
Right, I was just about to ask that, yes.
Yeah, it's basically it's just the next virus within this family of viruses that has just had an infection that's spread quite a lot. Um,
And how does it spread?
yeah, so COVID-19 is basically, so 19 is just a tracking number because this originated from the Wuhan district in China in 2019 in December. And basically it spread via human to human transmission. So to be specific, viruses are basically in particles that come out of people's eyes, people's noses, and people's throats, so in coughs and sneezes and in their saliva. And basically what has been happening is that these droplets have just landed on household objects and on objects in public spaces, and people have been doing what they've always been doing, but it's actually carrying a risk now. So if anybody touches household objects or anything in public spaces, so out and about on a road, in a supermarket, that kind of thing, basically what's happening is that they're picking up these droplets, and that's causing human to human transmission. So the first piece of advice, which is still really important today, you know, it's really important that people still follow it today. The first one is to keep social distancing going. That basically means when you're out and about, you should keep away from everybody else with a meter, and that's so that you prevent the human to human kind of transmission from happening. The second thing to say is that to prevent droplets being picked up on hands and things like that, the advice is currently to wash your hands with soap or with alcohol gel, and both of these practices are still really important, and it's extremely kind of integral to this condition that we keep doing these two things. Um, I think there might be a tendency to think that we can be relaxed after a little while,
Right.
but until we completely nip this in the bud, it's still super important to wash hands and to keep social distancing going for now.
Interesting question I have here is that these droplets, when they drop on surfaces, etc., how long do they live there? Because I've had conversations with people where some people say, oh, it can go on for 24 hours, 48 hours. Some people say 7 hours. I just don't know. Or does it vary in accordance to surface?
Um, I think the evidence is crude right now. I'd have to consult kind of experts to give a very specific answer. I think because we don't know that answer, we're just doing these practices to keep everybody safe and just to err on the side of caution. I think I've heard lots of estimates, and my answer is a wide range. So for
Mm,
that reason, I probably wouldn't be able to give a very specific answer. I think because they don't know exactly, I think that's
right,
why heavily relying on these processes and practices, because they're assuming the worst. I think they're assuming that if the particles, if the droplets stay for a long period of time, we should just err on the side of caution and keep all these traditions going.
right. Someone has just written in the comment box, what about wearing masks?
Yeah, that's a really interesting question. I think wearing masks is a supported practice just because whilst everybody recognizes that people are still going out during the daytime and at nighttime to do essential activities, wearing masks does minimize the risk even further of human to human transmission. I think it's really important at this point to say that there are a few respiratory masks which are actually recognized. And on my Instagram page, I have put a link from the British Medical Journal about the three masks which are recognized. I've seen a lot of derivatives from this. So I've seen um, I've seen scarves and hats and all kinds of makeshift things. I obviously, as a doctor, wouldn't recommend any of that. I understand people's anxiety and the reasons why they are doing that. I think the masks are just to further minimize the risk at a time when everybody is doing everything to try and keep themselves safe. Um, I recognize that it's actually really difficult to get a hold of them sometimes. So I will try and post a link if I can find one about resources and sources for this. They call them PPE, so protective equipment. But I think the take-home message from this is to recognize which ones are the supported ones, the
Absolutely.
recognized ones, just because a lot of people are wearing everything, and I'm not sure they're 100% effective right now.
Of course. Which leads me on to my next question. Now that we know what the COVID-19 is, what are the symptoms of COVID-19? Because again, there's been so many different things about, oh, I can't breathe, or, I've got a runny nose. What are the actual symptoms?
Sure. So the two main symptoms to be aware of are a fever. So I think the documented number is 37.8 degrees. And the second symptom is a dry cough. There are some non-specific symptoms which people should also be aware of. So things like aches and pains, feeling tired and having diarrhea. Um, I think at the start of the outbreak, it was extremely relevant to know if anyone had had recent travel to China or to high risk areas. Um, but considering that now there's very much, the virus has very much got a presence in 185 countries to date, I think a travel history is becoming less relevant just because it's already mixed around in lots of communities. But yeah, so basically Those are the two main symptoms, and the other ones are ones you should be aware of, but on their own, they're not that important.
Right, okay. What should I do if, for example, I were to become infected? Should I go
Sure.
to the hospital? Should I stay at home? What should I do?
Sure. So that's a really good question. So right now, about 80% of people who are COVID positive, they have mild symptoms, and it's only really 20% who have a very serious, severe presentation. So it's all depending on your symptoms, very much like any other condition, actually. So if somebody has very mild symptoms, the advice is to stay at home, recuperate, hydrate, take care of yourself, and to monitor your symptoms and seek medical help if you deteriorate or if things don't get better. In the 20% of cases which are really severe, so people who've got a very, a good going cough, or they have shortness of breath, or they develop chest pain, or they feel faint, all these kind of red flag symptoms in the world of medicine, that's a sign you should ask for medical attention as soon as possible. So, I mean, common things are common. We would expect someone to seek medical help from their GP, to contact 999, so an ambulance service, or to ask help from NHS Direct. These are the three main recognised ports of calls in the UK. And, as it stands, antibiotics are not very effective in the world of viral infections. In fact, they treat secondary bacterial infections and they don't treat the virus itself. So it's very, it is prudent to get medical advice if you're unsure about things.
I understand. And the hospitals at the moment, how are they coping? Is it still extremely, overwhelming, or are they more manageable now?
I think they're more manageable now. I think the latest global rates show that rates of hospital admissions and um, death rates have all decreased. This is very positive, and I think the burden of COVID on the NHS has decreased marginally. I think at this point we're looking for a trend downwards, and we're looking for a sustained trend downwards. So I think whilst the burden has lightly gone, it's definitely still there. And as long as all the rates and graphs improve and go in the right direction, then the NHS and hospitals will have a corresponding improvement with a little lag effect.
Okay, interesting. Thank you for that. My next question. Now, I am a huge animal lover. I have three dogs, and they are literally my little fur babies. I have been hearing all sorts of stories of people thinking, and please confirm whether this is true or not, as to whether you can actually catch the coronavirus through a pet.
Yeah, I mean, I've certainly heard a lot of news about and a lot of articles and a lot of media responses about pets. I mean, I think the take-home message is that it's very clear from what's happened in the world. So that basically means humans are giving it to humans, and there's nothing uncertain about that. I mean, specifically, when it comes to animals, I think people should be aware as a secondary thing that there is no evidence to suggest that animals are giving it to humans. Right now, we know that dogs and cats and ferrets are the three species of animals that have all had COVID positive tests. But whilst there aren't any strict guidelines on what we should be doing with animals, I should probably just say that, very reasonable steps would be to keep pets away from public spaces and to not, keep contact with everybody else's pets. But considering we haven't proven that animals are giving it to
Right.
humans, I think everyone should just be keeping their pets safe, in the first instance. Yeah.
I understand that Boris Johnson will be returning someday next week. There's talks of Monday, but maybe Wednesday, and there are some really important decisions to be made as to the way forward with regards to work life, school life, and just generally our lives. What is the UK's corona's plan going forward, do you think?
So I think there's no exact science, there's no exact kind of mathematical answer to this question, and the timeline is very much depending on how much improvement there is in hospital admission rates and death rates. So when the UK can say that there's been a considerable improvement from coronavirus, we'll then be in a safer, stronger position to relax the restrictions. There's no precedent for this, so obviously we as the government are looking for a sustained trend at this point, and they're also being extremely cautious. We know that several mainland Europe countries have already had improvements, and so they're looking to relax the restrictions even earlier than we are. I feel it's particularly delicate because as soon as the travel ban is reversed, then we're slightly at mercy of what everybody else does again. So if there's a wave somewhere else and everybody flocks to the UK, I feel that the situation and the equation will be really different. So I think it's good to be really cautious. I think the government are definitely, they're under some pressure to get this decision right, because the economy has definitely been stopped in its tracks too. So there are ramifications from having a sustained period of restriction. I definitely look forward to seeing the evidence from what's going to happen and all the evidence of improvement, which I presume the government are going to show before they relax the restrictions. I know that the University of Oxford is leading the way in the United Kingdom for vaccines right now. So that's also positive news that in the last week there have been lots of articles published that in the long run, they plan, so last week, lots of human volunteers agreed to start volunteering for the first trials in the UK. So whilst, the government are trying to get the short-term relaxation of restrictions right, in the long run, research institutions are trying to preempt the next wave with vaccines. So I think there are two important things right now in the short term and the long run. And I think it's a really delicate situation. So we're really looking for the government to provide lots of evidence that this is a very kind of supported, understood decision.
Right.
It's also going to be very criticized. So I think whether they get it right or wrong, there are always going to be critics. And likewise, in all the other countries where the relaxation of restrictions is happening a lot earlier, no.
To say what's going to happen, when in 3 weeks' time, if this lockdown does get lifted slightly, is everyone going to return as normal and just ignore really the severity of this?
Yeah, I mean, I think there has been a lot of understanding from Public Health England and from the UK government that these restrictions are quite strict. It is a lot to ask I mean, we're asking a lot when we ask people to do social distancing 24/7, having a social life, stop traveling, work from home, change your life completely. I mean, there is the understanding that this is difficult. I think like all challenges that have ever happened in the history of medicine and the history of epidemic, we're just going to try as much as possible to enforce the strategies. Certainly in London, I know that there is right now a very heavy police presence to try and make sure all the things that you're saying adhere to. So I've been walking around the parks, getting my daily quota of exercise. And basically there's a heavy police presence making sure that everybody doesn't stay in one place for too long.
to say what's going to happen, you know, when in 3 weeks' time, if this lockdown does get lifted slightly, is everyone going to return as normal and just ignore really the severity of this?
Yeah, I mean, I think there has been a lot of understanding from Public Health England and from the UK government that these restrictions are quite strict. It is a lot to ask to, I mean, we're asking a lot when we ask people to do social distancing
Yeah.
24/7, having a social life, stop traveling, work from home, change your life completely. I mean, there is the understanding that this is difficult. I think, like all challenges that have ever happened in the history of medicine, and the history of epidemiology, we're just going to try as much as possible to enforce the strategies. Certainly in London, I know that there is right now a very heavy police presence to try and make sure all the things that you're saying adhere to. So I've been walking around the parks, getting my daily quota of exercise. Um, and basically, there's a heavy police presence making sure that everybody doesn't stay in one place for too long. All the restaurants in, you know, central London are closed. So I think that whilst it is very difficult, I think in 3 or 4 weeks' time, when the government's to reassess this situation, all the restaurants